So, without further ado, let's get started and have a look at the first category, which is primary care and community-based integration. This award will recognise a team or service that has delivered a transformational improvement to patients close to their homes using collaborative and integrated approach across primary care and the range of health and social care providers. The three nominations for this category are NHS Central Lancashire with Nutrition Nursing Team Project, NHS Cumbria and their project Cockermouth Integrated Care Organisation, and again from NHS Cumbria with Workington Community Services. Let's have a look at these nominations.
In 2008 we set up a pilot clinic really. The patients who are enterally fed in the community, anyone who's got any kind of artificial feeding tube, before the clinic was set up, if they had a problem in the community, then they had quite a protracted way of being admitted to hospital for any kind of care and treatment. Be referred to the GP, then to the hospital, spend quite a long time in hospital until they could be listed and seen by a gastroenterologist, to then have their failing device replaced and then being discharged home. So what we decided to do was try and concentrate the expertise in one area, so we could look after these patients as a day case. We see them, treat them and discharge them the same day.
It's nice to know what they're doing, because if we go in A&E, patient, what's that? They don't know what it is. It's I've been to some hospitals and saying, well, what's up here, what's that? And I showed them and said, well, it's a peg fit. And they don't know. Well, I don't know anything about that. I'll put you on to somebody else. Well, it's no good.
The solution was to employ 3 nurses who were then trained with advanced skills to be able to diagnose problems, replace feeding devices and discharge patients from hospital. And it's a standalone nurse-led service, replacing the medical service that had previously looked after this group of patients. Prior to the service being set up, patients were being treated in hospital, and they could stay in hospital for some considerable time. The previous system was such that there was no dedicated list for these patients or dedicated team for them, so it depended on whichever gastroenterologist was on call at the time.
You phone up, yeah, and my wife phones up and says, Mr. Orton, there's something wrong with his peg, can we see someone? Yeah, no problem, come in 10-15 minutes, come down, and then straight in right away.
It also has significant financial implications for the Trust, because those patients are no longer requiring an inpatient stay overnight. Therefore that frees up beds for other patients to be used. And also as part of that, then each patient that comes into the clinic is templated, and there's financial revenue that comes alongside each patient episodes as well. And if you think about, we treated 600 patients in 2009, then that's a significant revenue to be invested back into the service.
Welcome to Cockermouth Integrated Care Organisation. There are 2 main arms of what we're trying to do here. Behind me is the temporary building that was put up within 2 weeks after the devastating floods in Cockermouth in November of last year, when 880 houses and 200 businesses in the town were washed out. What we saw then was a rise up of civil society, all the active groups in the town rising up to help ourselves. And what we've tried to do is capture that and bottle it for the future. We've 2 examples of where we're doing that. One is innovative initiative with what we call a Centre for the Third Age, when we're bringing together Alzheimer's Society, Age UK, University of the Third Age and other third sector groups co-located with us and seconding a nurse to them with a list of our highest risk patients, our risk stratified population. The second main area is integrating our own services, so we're bringing together the general practices in the town together with the integrated community hospital, community services, mental health services, and therapy services, all into one single team, a one-team approach to delivering care in the town. This has led to massive productivity gains. For example, in the first 3 months of this year, we admitted 145 fewer emergency admissions to the acute trust, so 145 fewer people getting to crisis point, and that saved in the first 3 months £250,000 on payment by results. We have a wide range of quality initiatives. Best practice rolled out on nutrition, hydration, falls, venous thromboembolism, 2 weekly hand washing audits, root cause analysis for C. diff cases, and we've improved the productivity in the community hospital, for example, by 300%. We've taken the cost down to 40% of what it was in 2006. So productivity through quality, integration with our community teams, and bringing together all the health services into an integrated group within the town.
In Workington over the last 2 years, we've had sort of a rolling programme of service development and integration, basically designed to help deliver the close to home agenda, so keeping patients at home, which is better for patients. The Workington area did experience a high rate of hospital admission, and it was recognised that health and social services weren't working particularly well together, so care wasn't seamless and people were going to hospital unnecessarily because the rapid response wasn't there to patient need. And the aim of this project really was to sort of provide a rapid response to try and prevent admission, but also to facilitate discharge, because as we all know, keeping patients in their own home is better for the patient, less risk of hospital-acquired infection, and recovery tends to be quicker. So this service was commissioned and was a highly successful service, resulted in about £300,000 worth of savings for the locality, and also again a high degree of patient satisfaction. Leading on from this project, we discovered a few things. One was that working with a third sector care agency didn't give us the degree of flexibility that we wanted. It didn't enable us to train carers up to the level that we wanted. So this led to the development of a new home care practitioner role. So we've got home carers now working within the district nursing team who have got nursing and social care skills. And these were the first workers of this type anywhere in the locality. So I think it's a really innovative approach. So I think really to summarise, the work we've done in Workington has helped to deliver the close to home agenda. It's created great patient satisfaction, which is backed up by patient satisfaction surveys. Referrers into the services again, we've got a lot of evidence to show the satisfaction. We've made massive cost savings, which then can be fed back into community services. I think from staff point of view as well, we've been able to develop roles. There's been a lot of shared skills and there's a lot of scope for role development, and I think greater satisfaction in delivering a quality service geared up to really meet patient need.
And the winner of the 2010 Primary Care and Community-Based Integration Award is NHS Cumbria with Workington Community Services. Well done, NHS Cumbria.